Welcome, everybody, and thank you for listening. Welcome back. So today we are talking with Wanda. She's been with Sarasota Memorial HealthCare System since 2008. She was hired as a Supervisor of Patient Information for the Emergency Care Center. She then went on to supervise the newly established Patient Assistance Program, where uninsured patients were helped by either finding a payer source or completing an application for financial assistance. Sarasota Memorial Hospital then created a much-needed position of Outpatient Care Coordinator, which would not only help patients navigate the ever-growing outpatient services, but also help them connect the dots from inpatient to outpatient. Currently, Wanda is the MDA ALS Clinic Coordinator, facilitates a stroke wellness club, a stroke support group, a cooking class for stroke survivors, 4 Parkinson wellness clubs and support groups. She's a distinguished speakers and hypnosis events in conjunction with the Neuro Challenge Foundation for Parkinson's, Mobility Challenge Group, Outpatient Cardiac Rehabilitation Navigator, as well as speaking events and other services as needed. Wanda moved to Sarasota in 1988 and calls the beautiful west coast of Florida her home. She's been married to her husband for 40 years, and they have 3 beautiful married and self-sufficient children. And she's a proud grandmother of 6. So quite an introduction, and what a blessing to our community for all these services and programs that she is in charge of, which I've been able to experience some of, and she does a phenomenal job. Wanda, welcome.
Why, thank you. You're so sweet.
So let's go ahead and dig into the topic of CBD and how it kind of falls in line with some of the things that you have done. When did you first hear about CBD?
Well, actually, I'm probably a little late to the party, but I was at a distinguished speaker event that was being held by the Neuro Challenge Foundation for Parkinson's here in Sarasota, and was one of the vendors that they had at their event. And then recently we had a disabilities fair, and again, I was reintroduced.
Okay. And what was your first impression on CBD and how it may or may not help people like the patients that you work with daily, or even yourself?
Well, patients have been asking and asking and asking about this. So we've done a little bit of research on our home. You know, there's still questions out there, but I know for myself, the day that y'all were here, that I had a really sore shoulder from computer work, carrying around computer bags, and the cream with the sweet-smelling peppermint really helped alleviate it for me. So I kind of got a glimpse of what some of the patients were trying and asking and reporting back. And, you know, as anything, we do educations and support groups. We're trying to make everybody live the best possible life they can, in however we can supply information and help.
Awesome. So with the relief you got with your sore shoulder, how do you feel that possibly a topical could bring some of your patients relief, since I know they have different ailments with all the different things that we listed in your bio?
Well, I certainly like the fact that it smelled better than the typical menthol rubs that people use. The peppermint was a nice break on that. But there are a lot of motor symptoms, rigidity issues that our patients experience, especially with like Parkinson's. And anytime you can get a relieving, relaxing effect, it certainly can bring benefit to those and to non-motor symptoms too, I understand, like with mood and sleep disturbances. But from the very get-go, I have to say that I'm not clinical, and I would not recommend anyone do anything until first checking with their doctor and making sure they are very honest with their doctor and tell all the medications and vitamins, everything they take, because you just never know when 2 things are not going to work together.
Yes, that's very true. And thank you for highlighting that, because that is huge. So we always do recommend before making any step into the world of CBD specifically, that you do speak to your doctor, and give them all the details, like Wanda had mentioned. Super important.
And we tell them that whether they're taking a vitamin E or baby aspirin or anything, even though it's over the counter, doesn't mean it might not have some interaction with one of your medications. And we also tell people to make sure they get all their prescriptions at one location. So a pharmacist might catch something that's a duplicate or an interaction. That's always a good resource for information as well.
Oh, that's interesting. That's an interesting point. I've never heard that before, but it makes sense. Okay. So let's talk about the THC end of the cannabis world. And what are your thoughts with that?
Okay, so I did go to a seminar because, again, I'm getting asked by patients and I'm non-clinical. I think maybe someday there will be a place for that. Currently, though, it's very concerning because it's so non-regulated. My information that I was given at the seminar was that prescriptions are written out such as low, medium, or high THC, which in my world, we like milligrams dosage 2 times a day, so many milligrams before with food, not with food. So the thought of somebody going to a dispensary with a script that says medium with no specific plant, no specific dosing, I am certainly nowhere to the point where I think that is a good idea, especially since in the world I work with, I don't think hardly any of them are prescription free. So everyone's already taking something. And until that's better regulated, I think that's a dangerous place for interactions to occur.
Yes. And we've actually seen some of that as well. Just working with the community, people that have went into dispensaries and purchased products, and they've either been laid out for hours in sleep, or they had interactions that they really weren't expecting to have. And then they're kind of like, no way will I ever go back to that. One thing that we've noticed at dispensaries, and I've only actually visited one, it's the largest one in the US, is the levels of THC are really high, really high, like 80%, 98%, very, very high levels of THC, where you can get some of that psychoactive part of the plant in there for sure. And a lot of times more than people really, really care for. So I love this topic because I feel like THC could be necessary for certain things, but again, I'm not a medical professional either. One thing that we've noticed is as long as it's very, very low doses and it's coming from the hemp plant versus the marijuana end of the plant, that it's anything that's under 0.3%. So there's the healing properties or the benefits of the THC, I should say, without the psychoactive. So sometimes that entourage effect with all the other cannabinoids can make sense and can be helpful to the customer, but everybody's different. We have some customers that don't prefer it at all. They stay with the broad spectrum. And then we have some customers that are like, this is what I want, this is what I need, and this is what works for me. But I definitely do agree that with the high, medium, low, sometimes you could get some interactions there that you're not wanting to actually happen. And or you could maybe not get the results from just like, say, CBD, and then kind of be turned off to where you're not wanting to try product again just because maybe your experience wasn't the best.
Yeah, that's just too much wild west for us right now at this point, with just so much, right, the regulation being such as it is. It's just, there's more that could go wrong.
Correct. Yeah. So have you had customers, or have you had patients that have been into dispensaries and that have had like their medical marijuana card? Have you guys entered into any of that?
Yes.
Okay.
Well, SMA certainly hasn't, but yes, I do a lot of support groups where they're free to discuss any topic they want. And this has come up in the past, along with a lot of other interesting topics. I have not seen any positive response to the point that I would suggest it, nor have I heard anyone say that their neurologist or physician was for it. At least not in the situation that we have right now.
Right. So when your community and your patients are in these groups and they talk about it, what are some of the things that they're trying to achieve?
Well, I think in this day and age, everyone wants to be as holistic as possible. And pharmaceuticals have gotten somewhat of a bad rap because there are pharmaceuticals out there, like we were talking about Parkinson's, that do amazing, amazing things for people. I think early on, when they're first diagnosed, they want to try to stay away from that till the last minute, or they get down the line and things aren't working as well as they wanted to. And with Parkinson's, of course, there's a lot of changes. A change such as a cold or a surgery can really mess up the system that they've worked out so perfectly with their food and exercise and medications. And so a lot of times they simply need to go back to their physician with good notes on how they're feeling. When do they have on times? When are bad times? When are new symptoms that have cropped up? And medications can be adjusted. So there's a lot of steps that, in my opinion, need to be taken anytime a person with Parkinson's or these other issues want to go in for a change. And of course, again, interactions and knowing exactly what you're taking and what you're getting and how to do it.
Okay, so the part with the good notes. So for any of our listeners that might be, at that crossroad, looking at more holistic versus the everyday prescription medications, what could you suggest in taking good notes? Where would be a good place for them to start?
Well, first of all, they need to chart how they're feeling throughout the day. Because things like Parkinson's, you have changes sometimes every hour, every 10 minutes, things happen. So you need to know, is morning, afternoons, evenings, after some rest, after exercise, what are you feeling? How are you feeling? Those kind of notes. So when you do have an appointment with a physician, you know exactly how you were feeling, what you took, how long ago, what you ate. That's very important on those kind of notes. Also, education is absolutely key when we talk about anything from exercise, medications, physical therapies, sleep, mood changes. Education on those topics are key. We have a monthly Parkinson's education. We do one in Bradenton, one in Sarasota, one in Venice, and one in Northport every single month. Another huge resource is support groups, because that's where people really get to be honest and talk. And they can say, this really helped me. This is a concern. Has this happened to anyone else? What did you do? Did it work for you? And socialization is a big part of both the education and the support group, because nobody understands like somebody else that's walking the same walk. So those components are all very important when you're trying to manage exercise, medication, holistic, all of that together. Get the education, get the support group.
Oh, perfect. So the support group you guys offer monthly, what other things do you offer that possibly we could let our listeners know about that may be local, or is any of it done remotely?
Oh, a lot of it's remotely, a lot of it's done in person. I'll start with the Sarasota Memorial. We have 3 insurance-approved rehab therapies for Parkinson's. We do the LSVT BIG, which is a one-on-one with a certified therapist, and that's for balance, walking, getting in and out of your car, out of your bed, off of the toilet. We teach all this strengthening muscle exercises to be done to keep what you have. So we don't want people to wait until they're too far down the road and have a fall and break a hip. As soon as you're diagnosed, you start taking these therapies, and possibly as the disease progresses, you retake the therapies. We also have the new Speak Out program, and both Speak Out and LSVT Loud work with not just the fact that the voice gets very quiet slow, articulation gets a little slurred. So it's not just about speaking